Hey guys, my name is Jessica Miller and I'm from your online HI 14 class and I did my project topic on ultrasound imaging. So what is ultrasound imaging? And this is something that we're kind of comfortable with because we've seen it and heard of it plenty of times in our life. Most of the time though we first think of ultrasound imaging and think of a pregnant woman going to get an ultrasound done to see her baby and how far along she is. But a clear definition is high-frequency sound waves to view soft tissues such as muscles and internal organs. Because ultrasound images are captured in real time, they can show movement of the body's internal organs as well as blood flowing through blood vessels, which is pretty neat. Because just as we're able to see a baby, we can see other areas of the body all the same way. How does it work? Well, it starts by a transducer, or a handheld probe that produces ultrasound waves. While it produces, it can then also detect ultrasound echoes reflected back. And as you can see in the bottom corner of the slide, I have a picture of a handheld probe, and the lady is pressing it against the patient's skin, and that's what they use to rub across the surface. And we've all seen these before. There is a ceramic crystal called piezoelectrics that produces the sound waves. And when these piezoelectrics are used in an ultrasound scanner, the transducer sends out a directed beam of sound waves into the body, and the sound waves are reflected back to the transducer from the tissues and organs in the path of the beam. When the echoes hit the transducer, they generate electrical signals that the ultrasound scanner converts into images of the tissues and organs. While piezoelectrics are still being used, scientists are also trying to discover other materials to use as a transducer in an ultrasound. So basically in the long run, if they find other materials that would work, it could save them money. Also by having more of a convenient material if it's something that's hard to get. This is a picture I found showing how ultrasound imaging works. It shows the machine and the screen and the patient laying on the bed. And basically, these are all wired together. If something happens with one of them, the other one can't work, and they all have to rely on each other in order to make the whole process and technology work. What is it used for? Well, it's used for diagnostics, during medical procedures, during therapeutic applications, and as we all know, most of these are performed on the skin surface. Types. Most are external and are performed on the skin surface, which is the kind that we see most of the time, like I was talking about with pregnant women. However, there are also internal ultrasounds. And I never thought about that, but the internal types are transvaginal, which requires a wand inserted through the vagina to view the uterus and ovaries. And I imagine they changed like that probe, handheld probe I showed you all in a picture. I'm sure they changed that end out to something like a wand, it says, to go into the vagina. Then they have transrectal. It's used during prostate diagnosis. And they have transesophageal cardiogram ultrasound. It uses a probe in the esophagus to get images of the heart. And most of these, like if you've taken A and P, you can kind of piece together and know how they work and what they are. Okay, benefits. So there's a lot of good benefits with ultrasound imaging. Most of us have had one, well, I say most of us have seen one, and there's nothing really painful about it. So they are painless. There is no needles, injections, or incisions involved. Patients aren't exposed to ionizing radiation, making the procedure safer than diagnostic techniques such as X-rays and CT scans. There are not any known harmful effects when used as directed by your healthcare provider. They capture images of soft tissues that don't show up well on X-rays. They are widely accessible and less expensive than other methods. And most of us know that too, because I know when I go to the dentist, they always like to charge you a big fee if you want x-rays done. Uh, so the benefits of ultrasound imaging determine that it's available and it can be used on just about anyone. I have pictures at the bottom of the screen of a man getting an ultrasound. So it shows that men actually get it, not just women. And also there's a lady with her dog that's actually getting one. So that shows that anyone can have an ultrasound done. There's no need for any patient to fear of this technology because there's no risks right now. And this is a good thing because I've seen that most technologies I've heard that some of them can cause cancer and other crazy things. Okay. As there's always benefits, there's also going to be limitations. So, ultrasound is not an ideal imaging technique for air-filled bowel or organs obscured by the bowel. Large patients are more difficult to image by ultrasound because greater amounts of tissue weakens the sound waves as they pass deeper into the body. And that makes sense because you can imagine a bigger person. I'm sure the tech has to press down a little harder or, to get good quality pictures for the physician. Um, Ultrasound also has difficulty penetrating bone and can only see the outer surface of bony structures and not what lies within. This is with an exception of an infant or an elder individual who has less bone cartilage, which makes sense. To have an image of bones or joints, an MRI is performed. Uh, so these limitations, they're pretty much self-explanatory, and they have good reasoning. There's also other technologies which we know of called X-ray or MRIs, and they focus on other areas of the body. Otherwise, there wouldn't be a way to take images of those areas that use another method. The past. So, the earliest notions of ultrasound were developed in the late 19th and early 20th centuries in Europe. Believe it or not. In 1973, the U.S. Department of Education recognized it as a profession in its own right. Over the next few decades, many experimented with the military, scientific, and industrial potential of ultrasound technology. Other pioneers in America and Europe continued expanding the scope of diagnostic medical ultrasound throughout the next half century. Ian Donald, working in Glasgow during the 1950s in particular, pioneered the use of ultrasound in monitoring fetal development. So that basically tells, as time passed, people got smarter with this, and they kind of took it their own way, and it stretched every which way. Now that just about the whole body can get ultrasounded. So the old ultrasound equipment I know is much bigger than how compact it is now, and right now it's not as compact as it will get. But I'm sure that they did not have technical savvy equipment as the doctors have now these days. However, there's no doubt that I'm sure they would be amazed at how far it's come and what it's actually growing to be present. So at this time, ultrasound is used in cardiology, breast imaging and biopsies, gastroenterology, head and neck surgery, neonatology, neurology, ophthalmology, avascular imaging, anesthesiology, pulmonology, urology, musculoskeletal exams, and emergency medicine. It's used in just about all main areas of the human body. And to the right, I have a picture of ultrasound equipment right now. This is the latest machine that I've seen. It can roll around, and I know it's wireless, I believe. And so that's as far as it's gotten right now that I've seen. I'm not sure if it's got any more savvy than what that looks like. In the present, again, the most current and future trends involve wireless solution with mobility, a way to reduce and help manage radiation dose and exposure, enhanced elastography capabilities to assess tissue stiffness, improving patient comfort and experience, advancing imaging equipment. I do know that one difference I have noticed now since the time I was born is that women can now have the option of having a 3D or 40 or HD ultrasound. And these types of ultrasounds are useful if a mother chooses to see detailed images of the baby's face in color rather than black and white. And this is something that my husband wants us to do when we do have kids because it's pretty neat. You can actually see what the baby looks like compared to the old black and white ones. Um, while these are the main things uh, that companies are trying to implement for the sake of the patient's comfort and safety, it will take time, of course, and some of these have already been implemented. However, there's still some work to go and it's going to take some time. As you can see in the bottom right corner of the picture, it's just a picture showing the difference in how a 2D versus 3D versus 4D or HD ultrasound picture looks like. Okay, current and future trends. The main goal is to ensure patient comfort and safety. The most current and future trends involve technologies that reduce and help manage ionizing radiation dose exposure, mobile, transportable, and wireless solutions, elastography capabilities to assess tissue stiffness, technologies geared toward improving patient comfort and experience, and entry-level advanced imaging equipment. So there's a lot in the making. The main goal always is to ensure patient comfort and safety. That's one of the main important things always. In the corner of the screen, I have a picture of a looks like a male. He's getting ultrasound. The physician or tech has the handheld probe in the right hand, and it's wireless, and they have a tablet in the other hand. How amazing is that compared to that other piece of equipment that I showed you a while ago? If this happens, and it might already have happened, and I just haven't seen it yet, pretty neat. And as time goes on, I'm sure people will continue to get smarter, and it's just actually crazy how technology is advancing the way it is. But I'm sure it will get to this one if it's not there. All right, well, that's all I got for y'all, and good luck to all of you the rest of this semester.